So what we're looking at now is the ability to look at multiple modalities on one workstation and one display. In the upper left corner here, we're actually looking at an IVUS image. This is all one patient, and these are all different studies performed on this patient. What we're looking at now is an IVUS through the aorta. And what you can see next to it and around it are different phases of an arteriogram performed during the same study that the IVUS was performed. And we're looking at this patient's thoracic aorta and how this endograft here is excluding the aneurysm. It has a little kink in the endograft, and you can actually see that over here in the IVUS. And then when we are done here, you can see that it looks much better. And then down here in the bottom, we have a chest x-ray, which was taken, which you can see the endograft here as well. What's neat is if we go over to this side, we can see a CT scan that was performed to this patient that we actually used in planning for the studies that you're seeing on the left side of the screen. And this is in the on-the-fly MIP-NPR mode. So I can take this and I can create any angles that I need to create to look and see what's going on. We have an aortic arch here. We're looking at the endograft. We see some occlusion coils that were here. But say I wanted to look right here and see what this vessel looks like right here, I can take this, I can put another view over here right now, and then I can take this view window here and find the spot that I'm interested in. I can put the cursor here, and then on the fly, I can create any oblique that I want around here. I can bring this one back over. I can look right down the center of the blood vessel, right here, and here you can see the actual graft. You can see vessels. This is contrast on the outside. This is some clot in that area. I have all my normal tools available to me. I can measure, I can zoom, make it bigger, bigger, smaller. All the different tools that would normally be available to me. I can say, hey, look, right there, there's something interesting, and maybe you should take a point of some time looking right there. And if I don't like this angle, I can just take it and I can change it. And here's the aneurysm actually that we've excluded.
The products of PACS risk vendors that can handle larger systems will have a big advantage because, for instance, Carestream handles the entire National Health Service of Scotland, right, in terms of PACS risk. That's an advantage, and not all the PACS risk systems can do that well, and quite a few can't. And if you can do that well, then the accumulation of quality data for submission in terms of ACO status is important and helpful. And I think that systems that can do that better eventually are going to be detailed in ACO contracts. To my knowledge, they're not yet, but I bet they will be.